yard look as good as my neighbor? Do I have a fast enough car? Is my wife hot enough? You have those types of stressors. Now, if we go to the 90s to now, where you have social media, now you're comparing yourself to, 8 billion people around the world. And we're promoting this culture now that boys can't be boys and that we shouldn't have testosterone and we must remove all young men's balls.
Want to welcome everyone who are here present, because if you've ever wondered what it would be like to have some of the top TRT experts in the world all assembled in one place, then this is a video for you to watch. I'm Mike. I'm the founder of Balance My Hormones and the Hormonist Pharmacy in the UK. And we're here to help men and women optimize their hormones, as many of our other practitioners. As Balance My Hormones, we also have a YouTube channel, Balance My Hormones. And before this roundtable discussion, we asked the viewers of the channel which topics they would like the roundtable to discuss. And 44% of the people on the roundtable asked to discuss something around testosterone replacement therapy. But I wanted to touch on what Rick had discussed about the declining levels of men's hormone levels, testosterone, as well as fertility. I think they say now 1 in 5 young men have low testosterone levels, and it's astounding. And one of the most frustrating parts of it is the reference ranges on from the labs, the various labs. Some of the doctors that can't quite work out what's optimal for one's health is not necessarily what's on that lab reference range. And so that must be very frustrating for the patient. I know myself, when I was first diagnosed with low testosterone when I was 22 years old, I think it was the LabCorp reference range request, it was 400 nanograms per deciliter to 1,080. And now it's gone so much low, I think in the 275 on the low end. And there are other studies that talk about testosterone as low as 15 nanomolars per liter, you may start seeing symptoms of low T. So I'll just pass around the microphone. Who wants to start with it?
So let me, as the resident lawyer here, let me start by saying nothing that we say is legal or medical advice, and nothing we say creates an attorney-client relationship or a physician-patient relationship just by listening or watching what's going on here. I'll turn it over to the doctors, but what I have heard and seen is that there's this gradual diminishing of the range that is acceptable for what is considered, I guess, normal. So when we look at, I guess when physicians look at a patient's testosterone level, total testosterone level, and it's between, let's say, 270 and now something like 780, I think is considered the peak on some tests. So that range is based on what's currently normal, as I understand it. So that if, let's say, 50 years ago, the range was 500 to 1,500, that would have been normal then. The fact that it's lower now doesn't mean it's optimal. In fact, it could mean it's sick. It could be that range is actually problematic. And I'd like the doctors to talk a little bit about, first, what that means in terms of patient care, but also, why are we not recognizing that just the diminishing levels doesn't mean that that's okay? It could, in fact, mean that environmental issues, endocrine disruptors, we could go on a list, and what should we do about that? What should physicians do about that?
Yeah, it's a fact that testosterone has declined. So this generation had lower testosterone than the fathers, and the fathers than the grandfathers. I believe environmental things like xenoestrogens, also stress and dirty lifestyle, insomnia, use of narcotics, alcohol, lack of physical activity, all this contribute to low testosterone. Men that are lousy and pathetic come to my office and they beg for a resurrection, and their levels are low. I mean, they are 299 and they are considered hypogonadic, but in 301 they are considered eugonadic, which is something not cool because we are more than numbers on a piece of paper. The number one evaluation should be considered by the clinical examination, the symptoms, they feel fatigue, the lack of sex esteem, sex drive, the erectile dysfunction, the obesity, the insulin resistance, and all this has to be considered are the parameters, and then check out a blood work. So men may feel bad below 400, the symptoms start below 400, bad lifestyle, quality of life comes below 350, I believe. So we need to see out of the box and consider the patient as a whole, as an identity, and not just as a number on a piece of paper.
Right. All I can really do is reemphasize that I'm going to, just because I am the only female on this panel, I will emphasize that the normal testosterone for female is 0 to 6, at least in our numbers. So actually, if you're a 0 as a female, you still have normal testosterone. And yet testosterone is not just key to libido, muscle building, but bone. Estrogen gets all the credit for bone. Testosterone is actually absolutely critical to women for bone, as are muscles critical to bone. So if you don't have muscles, muscles actually create, yesterday Eric gave a great talk on myokines. Muscles actually produce a myokine that's imperative for bone health. So women have to have testosterone. As to what is a normal value, I will push to say that, some people feel great with a very low testosterone. I do not. So I treat what my patients are telling me, and that may be even pushing them above the higher end of the range, right? Where it's not just at the higher end of the range, it may be quite a bit above that if every other factor looks good, and that's where they feel good. So I'm going to communicate. Some people, you can find a sweet spot. You overshoot it, people feel bad. You undershoot it, people feel bad. There's a sweet spot. It takes some experimentation to get there. So you really have got to, in fact, I always never look at the numbers until I make a mental guess in my mind what I think it's going to show. And when I'm shocked because it shows on the high end and the patient's still complaining about low symptoms, maybe there's another reason, maybe there's something else off, or maybe they do still need a little bit more, or we need to look at how they're being metabolized. We actually, in our clinic, follow all of the metabolites. Remember, it's not just, testosterone cannot just go into estradiol, which gets measured on blood tests, but you can actually measure things like 4-hydroxyestrone, which is a urine metabolite of testosterone that actually has very estrogenic properties and is a very bad estrogen for prostate health or breast health in women. So we actually follow metabolites of these hormones so we can really definitely optimize exactly where that point is. So it's not actually just looking sometimes at blood tests. If somebody's not doing the way you think they should, we look a little deeper and we look at how their body is metabolizing those hormones. If a lot of that testosterone is going into 4-hydroxyestrone, and it's one of my problems with DHEA with men is a lot of it does go into 4-hydroxyestrone. That's a free radical. It damages your DNA and it leads to cancer. So you have to know a whole lot of nuances. When somebody's not doing well, what else do we have to look at?
Yeah, I'll echo a lot of those sentiments, and a lot of it comes down to history and statistics and the whole concept of normal versus optimal. And so, as I mentioned, the numbers have shifted. It's kind of like, okay, let's make the whole analogy of making seats on a plane bigger to accommodate. Instead of addressing the underlying issue, we're going to lower the numbers to accommodate this. And I agree with what George says. It's we live in a very toxic world, unfortunately, with the EMF and these estrogens and stress, and we just haven't caught up. Had time to accommodate to the new environment that we live in. We lived in. Grew up, our ancestors had such a different environment than we do, and there's so much stress. We're working 24/7, constant light, phones in front of our faces, and stress, and our soils are depleted of nutrients. Food is devoid or made artificial, and it affects us. And as we're all seeing, I think men and women at a much younger age coming in with issues. And I agree. I definitely always more focus on the symptoms. I don't say I don't care, but the numbers are less important because there's a lot of variation. If they're a woman, for example, where a man is having symptoms of a thyroid issue, even if their numbers are quote unquote normal, I don't care. It's not optimal for her and she's still symptomatic. It's not maybe good in the blood, it's floating around in the bloodstream on a blood test, but it's not getting into the cell. That's why I look at intracellular nutrition, look at genetics, look at your gut. All these things can affect it. So even if your numbers are good, doesn't mean it's getting where it's supposed to be. I see that all the time. I'm sure everyone here does too. Same with men. How are you feeling? It's, guys are very fixated on the number, but it's more about how they feel. Not just on symptoms, but there's a lot of genetic changes too. When they look at your genes, they call CAG repeats on your genetic score, right? One guy at level 400 can feel amazing, another guy at 400 feels like crap. So that plays into it as well. So it's very individualized and it's more symptom based than looking at the numbers. But that being said, as we said, we are seeing a crisis here where we see how many people now hear about people having gut issues, the microbiome, chronic fatigue, low T, women having really impairment. It's rampant and it's very multifactorial. The environment and our lifestyle has a lot to do with it.
Right. I'm just going to add to, the physicians ahead of me kind of, and Dr. T over there, talking about the the reference ranges. It's kind of funny. If you go to different labs, you're going to see different reference ranges. But we also have total testosterone versus free testosterone, right? Then we have that sex hormone binding globulin, and I know you guys could tear that apart, and it's really interesting. But in the end of the day, in my practice, I don't really diagnose hypogonadism as much as my colleagues will, because I'm the harm reduction doctor. So people come to me already on testosterone or steroids, and then they come to me to be protected. So I've really spent my life in current day on protecting people that are already on testosterone. So my heart kind of goes out to you guys that have to make diagnoses, because it's hard to do, because you just can't treat a number. We don't treat, and the endocrine guys, they agree with this now. The endocrine guys I talk to all the time, so they you're 250, it's 250. The range is 250 to 1100. And depending on your Quest and LabCorp, and, we could talk with endocrine guys for hours upon how they came up with the data and where it goes back. And the truth is we are more obese and there's toxic things in the environment. So, but then we also have, we have different clinical effects and we have different effects in the studies where people from years ago, they were suffering too. We just don't know that. We just don't know because we didn't, the specificity on the examination and the clinical studies, doesn't really account for what happened back in the day. So we know that we're just heavier, unfortunately, and we're more toxic. So that's true. When you look for a diagnosis, you do the history and physical first. I don't look at labs into the end. And that's actually something that, my colleague over here said, it's you don't want to see the numbers. I actually purposely, when I do a history and physical on a new patient, which I miss because I don't really take new patients, is, I love, of course I do cheat. I do look at the numbers. Who do we got coming in? I could see that the hemoglobin and the hematocrit's up. It better be on testosterone. So if that's not a guy on testosterone already, that's a guy with hereditary hemochromatosis or polycythemia vera, and we're going to have some issues here. But in the end of the day, I do the history, you spend time, and you put it all together. And then you ask how you feel. Why are you coming in? What's your libido? What's your energy? And you'll by the time you're done with the old school history and physical, you're going to have already a diagnosis probably. And then the psychiatric standpoints are you can't tease the stuff out from each other with depression and anxiety. You just can't. So then you come to the laboratory side and you look at the total and the free and the sexually binding globulin. And then you can go, it's very interesting that there's a subset of men, and you guys probably know this stuff better than me because I don't focus my life on this stuff. How many people come in? How many guys? We're talking men. Again, I'm humble that women, it's a whole different deal itself. And it's a big marketplace now, and they're there too, and they deserve care. I'm just not an expert in taking care of women from the diagnostic standpoint. But if you look at a guy who comes in, his testosterone's 400 to 500 total, but his free testosterone's low because his sexually binding globulin is elevated. Or from a qualitative standpoint, it's very aggressive and it's very sticky, right? So you're going to see this effect. And then you're looking at these numbers, and then you're supposed to check these numbers a couple of times. You're right. In the morning, this is the endocrine guys. I'm not putting down the endocrine. And the urology guys are surgeons. They shouldn't be doing this. They're surgeons. Get back to the operating room. We're medical doctors. Orthopedic guys, they're surgeons. They're never going to know this. This is a medical subspecialty. It's not a surgical thing. So, and they agree with that, by the way. So you talk to the patient, you get the history, you look at the labs, and then you make a decision. What are you going to change? You start changing behaviors. You start working on, do they have low thyroid? Do they have depression? Then what does the heart look like in the kid? It's very complicated. So in the end of the day, that's how it should be done. It takes time, and you have to have an expert specialist that's a physician that knows it, and it's not pushing the drugs or just going to give some prefabricated medical regimen of 200 milligrams of testosterone with anti-estrogens and all. It's not. Then I know these guys don't do that. And the clinics that are out there that are doing it, they're going to be changing because they're not going to keep their patients because guys know that now. So you see how complex that is? You don't treat the number, you treat the patient, you use the numbers as a guide.
So one thing that's been interesting for me is I work with a lot of younger guys, and a lot of the discourse around testosterone replacement and hypergonadism, I have found tends to steer more towards age-related hormone decline. And one thing that I've found interesting regarding the anxiety and depression epidemic that we have through a younger generation, and as was spoken about before, when guys are going through these formative years with their lower testosterone, it creates quite a devastating psychological outcome in terms of, one, they become riddled with learned fear, which often gets diagnosed as generalized anxiety. And then this leads them to not taking on risks, not wanting to leave their mark in the world, not wanting to be brave and adventurous and challenge themselves when they're coming into their early 20s. Instead, they're becoming avoidant, procrastinating, and shying away from fear. And I think that this can lead guys to living a life or being in circumstances where they're like, hey, there's something really wrong here. And one thing that I work with a lot is younger guys who come in and they're doing like everything right, like 11 out of 10. Every single aspect of their life is dialed in. Their training, their nutrition, they're doing everything perfectly, but they're still hypergonadal. And I think my hypothesis that's happening is we're now seeing the downstream effect of what's happening when, these generations are getting lower testosterone, and then we're reproducing in an environment that's very, very heavily bombarded with xenoestrogens, particularly in utero when people are growing up. And we're seeing the same thing. I don't work with women, but it comes up all the time with women as well. Day 21 where their progesterone should be peaking and it's undetectable. And they're going to their doctor, they're getting put on antidepressants, they're getting sent to counselors, and they're not making that progress that they should be making. And I think that one thing that's very misleading and very confusing for a lot of younger guys is that what is now upper quartile of the reference range a decade ago was the bottom quartile. So I think it can be quite difficult when you're looking at these lab markers and going, okay, if this one's above range, like gamma GT, bilirubin, that may suggest that we have a problem that we need to investigate. But if the testosterone is out of range, then that actually might not mean the same thing. We're looking at the average of someone who's either sick, fat, depressed, or a combination of all three. And I think that can be quite difficult for these younger guys coming up.
So there was a paper that I cannot remember the name of the authors, but it came out in the 90s. And it said that life stress on average is 44% more in the mid 90s than it was 30 years prior to that. So if we think about the mid 90s, most people got what in the mid 90s? Access to something we can't live without now? The internet. Okay, so we get the internet. So if you think about people between, say, the 1960s and 1990s, you're looking at like your self-judgment, where you are in the world. You're trying to put yourself on, that continuum of like, yard look as good as my neighbor. Do I have a fast enough car? Is my wife hot enough? You had those types of stressors. Now, if we go to the 90s to now, where you have social media, now you're comparing yourself to 8 billion people around the world. And we're promoting this culture now that boys can't be boys and that we shouldn't have testosterone and we must remove all young men's balls, right? And it's doing a disservice. Like, we're supposed to grow up as men in a controlled environment. Like, it's okay for a couple of young men to throw hands if that's what it comes to, and then talk it out. But we're getting to a pussification of our culture, which is making guys not develop the way they should. We develop through adversity, and we're trying to tell them that everything is sweet and awesome in the world and that they can't have that, which is something they 100% absolutely need. Right. A lot of the stuff that I talk about with my clients and our students is that how stress affects everything, how you have this streamline effect of how stress controls your epigenetics and how that creates a storm of catecholamines that then causes a lot of other things like metabolic resistance, catabolism, atrophy, all this, and reduction of testosterone. So I think with all that, it's not like we can talk about xenotoxins, xenoestrogens, we can talk about red dye number 40, we can talk about all these things, but we also have to think about the other input that people are getting in through their eyes and through their ears, and the toxic stuff they're getting on the news and in video games, not being active enough and not going out in nature and being with their family and doing fun, cool shit.
So that reminds me what you said about the kind of feminization of men. I was at the Gay Pride in London, and there was someone who had a T-shirt on that said, "I survived testosterone poisoning," which I found quite offensive, really. So, I mean, it's this kind of part of the culture that isn't helpful, as is. And the reason why we mention the ranges is because some practitioners, they are confined sometimes by guidelines. And these guidelines are written by some of these societies, Endocrine Society. Fortunately, in the UK, we have the Society of Sexual Medicine, and then also the ISSAM, International Society of Aging Males, that really are clued up into, in particular, International Society of Aging Males. And they talk about in some of their studies, like I said, it's a higher number in which your testosterone levels, you start experiencing symptoms of low testosterone. So there might be closer to 500, I believe, for 15 nanomoles per liter, as I said earlier. If you found this chat as valuable as we did in bringing it to you, why not give us a like to show your support? And remember, knowledge is best when it's shared. So pass this video along to your mates. Speaking of support, have you subscribed to our channel yet? If not, consider doing so now. We'd be chuffed if we had you on board to our community of wellness enthusiasts. Hit the notification bell. It'll keep you in the loop so you won't miss out on the latest natter about health and balance, and you'll get the YouTube video directly to you. And if you've enjoyed this video, there's plenty more where it came from. We have a wealth of different videos exploring various corners of health and well-being. Speaking of which, why not take a look at these? They're a few of our favorites, and we reckon you'll find them particularly enlightening. We've barely scratched the surface today, For more insight into hormonal health, why not explore our channel? We've got a wealth of content awaiting your attention, and you can also visit our website at balancemyhormones.co.uk. So, this is Mike from Balance My Hormones, your beacon in the fascinating world of hormonal health. And until next time, remember, knowledge is power, and your journey to wellness starts here with Balance My Hormones.